Welcome back from break. It's now my honor to introduce a person that's joined our team to support us in the development of a really important project that's been a dream of mine for years. And we're going to be talking about the Maternal Mental Health State Report Card Project. Caitlin Murphy is joining me now as on the main stage, and she's a research scientist within the Health Policy and Management Department at the Milken Institute School of Public Health at George Washington University. She brings over a decade of mixed method public health research, health policy research, and health systems research in the fields of maternal and child health, women's health, reproductive health, and health among low-income communities. She is well recognized for her content expertise in mental health, trauma, and social determinants of health, as well as the pathways for addressing social determinants of health in healthcare settings. She has supported women's and children's health research initiatives at many other organizations, including Johns Hopkins Bloomberg School of Public Health and the Miss Foundation for Women. We're really honored to turn the time over to you now, Caitlin, to talk about the first ever state maternal mental health card. Thank you, Caitlin.
Great. Thank you so much, Joy. And good afternoon, everyone. I hope everyone's been enjoying the forum as much as I have been. And I'm very excited this afternoon to share with you a project that the Policy Center for Maternal Mental Health has been working on and will formally launch in May, the Maternal Mental Health State Report Cards. I'm so grateful to the Policy Center for the opportunity to work on these together and to then share the progress with you. Next slide, please. So for the next few minutes, I'll be providing a sneak peek preview of these report cards before their launch. So first, what are the maternal mental health state report cards? Second, what are the methods and the measures that were used to create them? And last, I'll briefly highlight which states are emerging as the top performing states in these report cards. Next slide, please. So what are the report cards? The report cards are really snapshots of state efforts to address maternal mental health across three categories. First, the state ratios of maternal mental health providers and programs to need, and need being those maternity populations that need more intensive mental health support. Second, the state progress in making sure that universal maternal mental health screening and screening reimbursement for providers is occurring. And third, state efforts to make sure that mental health services are covered and that treatment is received. We know that screening, reimbursement, and treatment rates are still far too low across all states, and the report cards will really aim to provide credit where progress is occurring. Next slide, please. The Policy Center envisions multiple uses for these report cards, such as education and coalition building, advocacy and policy making, and benchmarking of state progress, since the goal will really be to update these report cards annually. It's very important to note that these 2023 report cards are considered preliminary. There are many, many data points that the Policy Center knows to be relevant to maternal mental health and hopes to include in the report cards, but either A, the data is not available, or B, the data isn't yet available. For example, the HEDIS maternal health screening measures have been launched, but we know that the data is preliminary on those. So among the data that is available, we included the measures that we believe to be the most important to maternal mental health. And it's the Policy Center's hope to keep incorporating new measures yearly into the report cards as the data becomes available. For example, future measures that the cards will and could include are the maternal mental health HEDIS measures. Second, if states cover maternal support such as doulas, peer supports, and community health workers, state efforts to fund community-based organizations that serve mothers, and if states require implicit bias training for their maternal health providers. We know the extremely negative impacts of racist interactions on maternal mental health and quality of care. So the goal with this kind of final measure is to track state efforts to address this issue. Next slide, please. So how were the report cards developed? A very high-level overview can be found on this slide. First, the Policy Center identified all available state and county level data sets that might be relevant to maternal mental health. And second, using these data sets, the Policy Center developed 12 discrete state measures across 3 measure categories. Then states were awarded between 1 to 5 points for each measure based on their performance on the measure. And then last, states with the most points were identified as top performers in their efforts to address maternal mental health. And we'll be highlighting some of those top performers in just a moment. Next slide, please. So now I'm going to walk through those 12 measures across the 3 categories, with the first category being the state level availability of maternal mental health providers and programs. Within this category, there are 3 measures looking at a state's maternal mental health provider-patient ratios. First, does a state have an adequate ratio of perinatal mental health certified providers, or PMHC providers, to patients? If you're less familiar with the PMHC credential, this credential is currently supported and promoted by PSI and ensures that mental health specialists have been trained and tested in providing mental health services specifically to perinatal populations. And we've considered an adequate ratio to be 5 PMHC providers to 1,000 maternity patients. To 1,000 births. And this ratio was created by the Policy Center by calculating the number of hours of maternal mental health support needed in each state in a year, and the number of hours that a PMHC provider could provide in a year in each state. We found that only 2 states, Montana and Vermont, currently have this ratio of PMHC providers to maternity patients to meet the anticipated mental health need. Our second measure was created similarly. Does a state have at least a ratio of 1 reproductive health psychiatrist for every 2,000 maternity patients? We're currently still gathering the data on this measure, but we will have it available for the formal launch in May. Third, does a state have at least 1 community-based organization that serves maternity patients for every 20,000 births? It's important to note that this measure is very preliminary and should be considered less reliable for 2023. This is because there currently are no extensive lists of maternal health CBOs in the US, and the list that does exist was created by the Policy Center through a manual lookup. This list created by the Policy Center will keep being updated over time. And in fact, we warmly welcome you to submit CBOs in your state that you think should be added to this list. If you go on the Policy Center website, you'll actually find a form there that you can fill out and submit your CBOs you feel might be relevant. Among the CBO lists that the Policy Center does have, you'll see that 8 states currently meet the 1 to 20,000 patient ratio. Next slide, please. There are 2 additional measures that were included in this first category. First, does a state have an inpatient perinatal mental health treatment program? We see that California, North Carolina, and New York do. And does a state have an outpatient intensive or partial hospitalization perinatal mental health treatment program? These programs can be found in California, Minnesota, Missouri, Nevada, Pennsylvania, Rhode Island, Utah, and Washington State. Next slide, please. So moving on to our next measure category, this category looks at state progress towards universal maternal mental health screening and screening reimbursement, knowing that we're still a long way from universal screening. First, the Policy Center looked closely at state Medicaid policies related to maternal mental health screening and reimbursement. And using Commonwealth Fund data on this topic, we found that Arizona, California, Colorado, Florida, Illinois, Massachusetts, New York, Tennessee, and Virginia were found to have the clearest requirements of maternal mental health screening and reimbursement. When we turned to the private insurance population, we were able to look at how frequently providers are billing private insurance for maternal mental health screening using private insurance claims data. And perhaps unsurprisingly, private claims for screening rates were found to be very low. In all states, less than 3% of maternity patients' providers bill private insurance for screening. And in only 2 states, Colorado and Indiana, did over 1% of maternity patients' OBs bill private insurance for screening? And this shows us that from a private insurance claims point of view, reimbursement for screening is really not occurring. Next slide, please. Our third and final measure category looks at state efforts to ensure insurance coverage and mental health treatment. Under this category, we included 2 measures to understand if a state is making insurance coverage available to those who need it the most. First, has the state expanded Medicaid? This is the case in 38 states plus DC. Has the state extended Medicaid postpartum coverage to a year? This is the case in 35 states plus DC. Next slide, please. We also wanted to understand the rates of mental health treatment and provider reimbursement for this treatment. While this wasn't readily available among Medicaid populations, we are hoping to include this in the future. For now, the Policy Center looked at private claims data to understand how frequently perinatal providers are billing for mental health treatment. We found that in only 3 states, Massachusetts, Rhode Island, and Vermont, over 15% of prenatal patients' providers billed private insurance for mental health treatment. And in only 1 state, Rhode Island, we saw that over 15% of postpartum patients' providers billed private insurance for mental health treatment. And considering that 1 in 5 perinatal patients experience a mental health condition, we know that these rates of patients receiving and providers billing for treatment can improve. Next slide, please. The next few slides provide a very high-level sneak peek at some of the best performing states across the 3 categories I just mentioned. So first, we see here that in Montana, Vermont, and California, these are considered some of the states that are performing at the top in terms of ratios of mental health providers to patients and availability of mental health programs for maternity populations. Next slide, please. On this state, we see that California, Colorado, Illinois, and Massachusetts are some of our top performers when it comes to maternal mental health screening and that screening reimbursement. Next slide, please. And last, we see here that Vermont, Massachusetts, and Rhode Island are 3 of our top performers when it comes to insurance coverage and maternal mental health treatment, billing, and payment. Next slide, please. In terms of next steps, we're very excited to formally launch these report cards at a congressional briefing this May. And additionally, a policy roadmap will be launched to support states in their efforts to improve maternal mental health across the categories that we just described here. And this roadmap will be launched concurrently with the state report cards in May. We hope that this has been helpful and also feels exciting to you. And if you'd like to keep updated on this project, we encourage you to subscribe to the Policy Center newsletters at policycentermmh.org. Also, if you have any questions or thoughts on this project as it continues to develop, please feel free to reach out at info@policycentermmh.org. Thank you so much for joining this session, and I hope you enjoy the rest of your time at the forum. I'm going to turn it back over to Joy.
Thank you so much, Caitlin. And I also want to acknowledge not only Caitlin's leadership, but also our Director of Research and Impact, Rebecca, and then Adam, who's joining us today as well from Q Research. Thank you for your leadership on this important project. And we do, as Caitlin mentioned, welcome your feedback. Would love to hear what you have to say and have time to make adjustments potentially as well. So thank you again for your leadership, Caitlin. What an exciting project.